You're listening to the Beyond the Prophy podcast, where we help you out of career burnout so that you can reclaim your personal freedom while pursuing your passion. I'm your host, Jasmine Haley, entrepreneur, influencer, and educator that will help empower you with our interviews, strategies, and straight talks. If you're ready to push past your comfort zone to your greatness, you have found the right podcast. Stay tuned and listen in. This Beyond the Prophy episode is partly sponsored by Young Dental Innovations.
Hey, this is Jasmine, host of Beyond the Prophy podcast. We're here at the Hinman on site, and our guest for this episode is Trish Lewis Clark. She is the Director of Practice Development with Phoenix Solutions of the Lowcountry. But she's also the founder and CEO of the Dental Detective. And I tell you, I cannot wait for this conversation right now. So first we've got to start off with what exactly is Phoenix Solutions of the Lowcountry? I just love the explanation that you gave. First of all, welcome.
Oh, thank you. Thank you for having me. It's my honor and pleasure. Thank you.
All right, so tell me about the Phoenix Solutions.
Phoenix Solutions of the Lowcountry is my main company, and with that, I do a lot of different things. I coach, consult, and speak. I do a lot of inspirational and motivational speaking, so it kind of all falls under that aspect. And when I decided to go in the direction of the dental detective, that is its own identity, and it also is a trademarked, registered, and I'm very proud of that.
Yes. I love that you've done that. That was actually one of the first things I did with my business, and because I just wanted to make sure that I maintained what I was creating and didn't have anything affecting that.
Yes, ma'am. That's important. We got to protect it.
Yeah. All right. So why did you choose the Phoenix? Because when I hear the Phoenix, you know what I think of, which is so funny. You can tell I'm a nerd. I love X-Men.
Uh-huh.
And I think of, is it Raven? I think it may be Raven. She turns into a phoenix.
It's beautiful.
Yes.
So I've been through a lot in my young life, and we're just going to use it as a young life, okay, because I still got a lot of living left to do. But it is a very strong symbol for me, and when I was looking to rebrand myself, because I had another name for a previous company, and it just wasn't me anymore, I needed something strong and powerful. And you know what? I prayed a lot about it, and the Phoenix kept coming to mind. And I was like, So I started looking at different Phoenixes, and they just weren't attractive. So I had this one created with my brand, my color, my style. And a Phoenix, what does a Phoenix do? It rises from the ashes. And I've done that multiple times in my life, and I continue to do it. Rise above, and so can any practice that I deal with.
Yeah, wow, wow. So what led you to this? Like, what's your why? What brings you to doing the work that you're doing?
Oh, I have so many whys. I know, like, everyone says you need a one why. I have more than one why. I have such a passion for dentistry. I've been in dentistry over 30 years. I originally got into the field because I had a bad experience as a child. And I did not want anyone else to ever have to go through what I went through, so I wanted to be able to educate the patients on their different options so that they understood that it doesn't have to be a terrible experience. And then my why has grown and changed over the years, and now I just love to inspire people to do better in whatever they're doing, whether it's dentistry or not.
Yeah. So how did you come up with the dental detective? Like, what exactly do you do?
Okay,
here we go. When you were speaking to someone, and I was like, oh, I can't wait.
Oh, yeah, here we go.
Tell me what you do.
Okay, so without giving it all away, you want to go to dentaldetective.info to check that out. However, some of the things that I thought of over the course of my career that were like, I was always saying it, you know, when I was helping other practices, when I was coaching and consulting before, I was like, you know what, you just need to dig a little deeper. You need to be a detective. You need to be a dental detective. You know, like, oh, I didn't know they had a secondary insurance, or, you know, there was just a lot of things like, oh, I don't know what to do. Well, dig a little deeper. The answers are always going to be there. Guess what you do? You have to become a detective to get them.
Yeah.
So then I start thinking, you know what, I'm using this all the time. I need to take that and help practices with this. And one of the things I noticed the most, I was with a practice for 7 years. Well, I've been with a lot of practices over my course of 30-plus years, but one in particular, when I knew I was no longer going to be there, my patients were so sad. And I call them my patients because I had developed that relationship with them. And what they said was, we stayed because of you. And that was powerful to me. And I got very emotional, and I said, why? And they said, because you never stopped being our advocate. You would explain the treatment. You went over the finances. You offered care credit. You sent me texts through Revenue Vault. You did all these things for me, and you were always my advocate. And then I thought, you know what? They came in and they stayed because of me. How many patients in practices didn't stay because of whoever was there, didn't do what they needed to do to go above and beyond? So if I can go undercover and help practices discover hidden potential and profitability for their practice from, here's the key, a new patient's perspective. And that's how the dental detective was born.
Wow. I worked in situations where someone was toxic, but was always available with a mask on, really, where the employer could never potentially see that they were the reason that there was issues with patient attrition.
Exactly.
And now you have someone where they don't know. Wow.
So,
oh my gosh, that's crazy.
It's incredible.
I love it, though.
And here, I just want to make this very clear. It's all positive. If you know me or you get to know me, I am a positive person. Throw a negative at me, I will come back at you with 10 positives, because there is a positive in everything we go through in life, and that's important. So when I come in and I go undercover, it's to help the practice improve. It's not to go negative. It's to go, you know what? And we're just going to use this random name. Susie, you did a great job answering the phones, but let's work on the follow-through with converting that into a yes so we can get them scheduled, and let me show you how. And it's knee to knee, eye to eye, shoulder to shoulder. I'm not standing over anyone. And you know what? I've been in their shoes, and they can relate to me, and I can relate to them, and they get it. They get it that I get it.
Yeah, absolutely.
And that is what I bring to the table, that most don't have that one-on-one experience with a majority. And I joke and I say, I've done everything in the practice legally except for drill, fill, scale, and anesthetize. I've done it all, right?
Yeah.
So I really can relate to every position in that practice. And I love coaching doctors. I love coaching hygiene. And when I say coaching, I mean getting in there and helping them discover their full potential. Because we all have it, but you got to have two things. This is my key thing, and I'm going to share this little tip with you. A willingness and an ability. If you have those two things, you are 100% unstoppable.
Absolutely. I love that.
Nothing's going to hold you down.
Absolutely.
Or back.
Yep. So what would you think is the biggest barrier to patient attrition? What do you think, in your own opinion, from your consulting years?
I feel that a lot of people don't know what they don't know, right? So they don't want to go out of their comfort zone to learn and grow. I always hear, well, my doctor made me go to this course. He signed me up for this. I'm required to go through this manual. We had another consultant come in, and they have all these protocols we have to learn, and it's just overwhelming, Trish. So for me, I'm a very personal one-on-one person. I want to get to know you, and we'll just keep using Susie.
Yeah.
Hey, Susie, what's up? Susie, tell me, what is it that inspired you to stay at this practice? What makes you happy here? Where do you see yourself going? I want to get to know them.
Yeah.
Because behind all of that, there's a reason why they're there. And sometimes if it's a paycheck, it may not be the right place for you.
That's so true.
Right?
Yeah.
And if it's something that I can uncover and discover about them, ultimately it's going to help the practice. So maybe she's shy. Maybe she really doesn't want to be answering the phones. Maybe she really should be working on insurance in an office somewhere with no windows, or with a window, right? So you have to learn who they are in order to help them. And most offices don't ever take the time to get to know who they've hired.
No. And the people that are hired don't even know who they are. So a lot of us are walking around that don't even realize what our strengths are.
Right. And anybody that's listening right now, can you name the eye color of every single one of your team members?
Oh, wow.
Think about that. You got beautiful eyes, by the way.
Oh, my goodness. Well, thank you.
But it's things like that. You need to stop. And when they say smell the roses, it just doesn't mean like on a flyby, like, oh, that smelled great. No.
Yeah.
No, stop. Look at the beauty of it. Look at the beauty of everything around you. Mm-hmm. We're here.
Yeah.
We're living, we're breathing, and every day is a gift. It's a blessing. Unwrap it. Enjoy it. Appreciate it. And your job is the same way. Mm-hmm. Because, yes, we are all replaceable. Yeah. But you know what? Make yourself so remarkable that no one ever wants to replace you.
Yeah, absolutely. So let me ask your opinion just from your consulting years. I would love to know, like, why do you think there's so many of us that are burnt out? Why are there so many dental professionals?
Oh, my goodness. Do we have enough time for this? Oh, let me just sit back and get some more water here. Okay. So I feel, to answer this question, that most people are burnt out because they were overworked, underutilized, and never appreciated. Those are my top 3 right there.
Underworked, underutilized, and never. Yes, amen, amen, amen.
Do I get an amen?
Yes.
Oh, whoa.
That's so true.
It is, because if you're not, for instance, I was in a practice, and obviously I can't name names. There was a lady up front. She says, all I do is just, hear how I say that, just answer the phones. I said, all right, let's pull up a chair. We need to have a talk. Because that's not all you just do, right? You come in, you turn the lights on, you get the Keurig going, you get the living room looking good, you make the doctor's first cup of coffee. Right there, you just did a lot more than just answer that phone. You make his day. You know why? Because he told me he appreciates you bringing that coffee. And you know what? When you answer that phone, you do it with sunshine in your voice, and I appreciate that about you. So you bring joy to whoever's on the other end of that line, whether you realize it or not. So don't say you just did something. You just did a whole lot.
Yeah.
So step back and appreciate what you just said to me.
Yeah.
Right?
Yeah, absolutely. I feel like culturally now we are just, everyone's so busy. We don't take that time, and we don't take, I mean, I've just had to, for me personally, I've been on a whole journey of gratitude. Because for me, if I don't stop and think about how many things God has helped me through and has blessed my family with,
amen,
I would be so miserable. And I have been.
And I'm sure you've met those people, right?
Yes.
And they probably do not have the strong faith that you have and I have to get us through some of our darkest days and hardest hours.
Yeah.
Because that's how you're going to get there.
Yeah. Absolutely. Absolutely. Man, you know, one of the reasons why I think I had to leave out of the op when I did 7 years ago was when I left. I went into full-time education. Was primarily because I was underutilized.
There you go. One of my top 3.
And then I felt like I had no growth.
Right.
At all. And I didn't feel like I was appreciated. I always felt like, oh, is there a chance that I can see that now as you're talking and I'm thinking about my own situation. Definitely that's how I felt. But still, even though I left, I truly wasn't fully happy.
Right.
Because I still needed to do a lot of inner work.
Right.
For myself.
Figure out your why.
Yes. Mm-hmm. Absolutely. Which is why I'm so passionate with Beyond the Prophy and helping other people figure that out. Because I feel like I have seen the effect of clinicians and providers not taking care of themselves and then meeting patients that are at very, very high risk of certain behaviors that lead to higher HIV rates and substance abuse disorder. And we're serving them, but we're not doing it adequately because we don't have our act together.
Exactly.
So what happens is they go back out into the community and they do not seek care. And someone that's not seeking care is infecting more people in our community. So it's like everything is wrapped up in one. It's not just about us.
Right.
It's about our whole entire communities that we're serving.
I mean, you affect so many people throughout your day. I mean, I cannot begin to tell you how many people. I'm a hugger. If I like you and I know you, and even if I don't like you, you're going to get to know me, and I'm going to hug you at one point, okay? So my patients come in for hugs. They'll come in to practices where they know that I'm at, and they say, Trish, I knew you were going to be here today. Can I please get a hug? Because that made their day. One lady just recently lost her husband. She came in. I could tell. I could read her body language. She was sad. It wasn't, we hear it. Nobody likes to come into the dental office. Well, my job is to make sure when you come in, I'm going to get you to smile, and I want you to smile when you leave. That's always my goal, right? So I said to her, do you need something? Is there something I can help you with? And she goes, do you have a minute? I said, yes. Pulled her into a little consult room, sat down. I said, you want me to get you a cup of tea? Yes. Got her a cup of tea. She just lost it. She started crying. She goes, I lost him last week. I didn't know if I should show up to this appointment or not. I know it was a commitment. I mean, she just went on and on and on. And I said to her, take a deep breath. It's okay. We're here for you. If you want to reappoint, that's fine. She goes, no, this is all I had to look forward to.
Wow.
I said, well, you know what? We're going to make this the best experience you can get today. I don't have a back rub or a foot rub for you today, but I tell you what, we'll get you something, right? So, we sent her flowers, and she called, and she cried, and she said, nobody even acknowledged my husband's passing. There's not many of us left, and all of our friends are gone, and, that was her whole world, to make her dental appointment.
Wow.
And to get those flowers from us.
Wow.
So how impactful is that for one person?
Yes.
And on a side note, we got 3 patients from her telling someone. They called us. The 3 people she told called us, and they're now patients at that practice.
Yeah.
I want to go to a place that cares about me.
As a human being?
As a human being. Not because it was a spot to fill, a hole to plug, a production, a number, or an insurance to file, but because you pulled me aside, you gave me a cup of tea, and you sat and you talked to me, and you cared about me as a human being. I said, absolutely, every person in the door.
It all boils down to connection. We're all looking for a community and connection. Mm-hmm. I see so many people who have lost that sense of connection, and they're roaming about, and they are depressed, and they have nothing. Mm-hmm. And I love you that you shared that, because that's...
It's important. It really is, because at the end of the day, we're only on this earth for a limited time, right? Mm-hmm. It's the time that we fill it with, the productivity of giving, a giving heart. Yeah. Bring joy to someone. Buy a cup of coffee, or pay for the person behind you. Give joy. Yeah. I mean, because we can't take that joy with us. Nope. And God willing, we all know where we're going to go, right? Yeah. So bring it to this earth while we're here. Yeah. Be a blessing to someone today. Go out there and inspire someone to smile. How many times have you walked down the street and someone's looked at you and they kind of started to smile, but then didn't, and then when you smile, their whole face lights up, right? Yep. So they're just like, they needed that smile. They're thirsting for that smile. People need that human contact. Yeah. They need to know that they're not a number. Right. And that you do care. Mm-hmm. And you should bring that into dentistry.
Yes.
Every day, all day. Let's do it.
I love it. All right, so here's my last question for you. What is the best career or personal advice you've ever received?
Yeah, that's me being silent. There's so much. It's like a disco ball going off in my head with all these things people have said to me over the years. How can I pick just one, Jasmine? Okay. I remember early in my career as a dental assistant, I wasn't sure if I was going to stay in the field. It was a pivotal moment in my career. And I worked at a dental clinic out in California. A 21-year-old, not much, pretty close to my age at the time, came up, and she had something in a baggie. And I was like, okay, what's happening? I don't know which directions this is going to go today. Okay. And she said, she wasn't talking real wide, so I couldn't tell what was going on. And I said, are you okay? And she started crying, and she shook her head no. So I knew that I had to reach her. So I pulled her aside, and we sat in a little private area. She opened up her hands to show me what was in the baggie. It was a sandwich, and in a sandwich were her 2 front teeth.
Oh, my goodness. And
I looked at her. I said, what happened? She goes, they told me I had gum disease, but I didn't understand. Literally, by 22, she was in a full denture, upper and lower.
Wow.
And I thought, not on my watch, not anymore. If I can touch someone. And she looked at me and she said, by the time I was done talking to her, she said, thank you for being you. And please don't ever stop sharing your knowledge with people, because your knowledge is going to get me through this. And I was like, what? And it was mind-blowing. So it didn't come from a colleague. It didn't come from anyone famous. It came from a 21-year-old that brought in both of her front teeth in a sandwich, telling me, don't stop doing what you're doing and educating people. For God to send me that message, you need to stay on this path because someone needs to hear your message to help them. So that was the most powerful thing that had ever happened in my career. One of the disco ball thoughts. You like that?
That was beautiful.
Thank you.
That's why I love what I do, because hearing the stories like that, talking with people like you and many others we've had here, it just invigorates me. It keeps me empowered. It keeps me motivated. And that was really, really beautiful. Thank you.
Oh, you're welcome. Thank you.
So please tell me where listeners can contact you if they were interested in finding out more.
Yes. You can go to phoenixsolutionsoftheLowcountry.com. But if you don't want to write all that down, just go to dentaldetective.info, because you need my info. So there's a reach out to me on that page. And make sure you do it on a laptop or computer, because it's a lot of fun. I've made my page interactive. So, yes, okay. I had a lot of help with that. So, for
Very
sure.
Cool. Well, thank you so much for being on the show. I appreciate you.
Oh, I appreciate you. Thank you so much. My pleasure.
Thank you.
Thanks for tuning in to the show. We value each and every one of you. Dive in deeper by visiting the show notes for this episode or listening to more episodes on beyondtheprophy.com. If you found value in the show, share with a friend and leave us a review. We will see you next time, BTP family.